With retirement on the horizon, 70-year-old Bernard Trumpower decided to resume his interest in photography.
In June of 2010, I set out to photograph all approximately 1,000 of the Brout orchids in the collection.
The collection is housed in the Life Sciences greenhouse on the Dartmouth campus, where Trumpower has been teaching biochemistry to first-year medical students for the past 41 years.
The anti-malarial molecule.
Whether analyzing cell mutations for new drugs to treat malaria or looking through the camera lens at a new orchid species, Trumpower is what you might call driven. Even a cancer diagnosis failed to slow him down.
I had lung cancer twice. I quit smoking in 1995 when I had my first run-in with lung cancer. And that was when they told me I had a little bit of COPD.
Chronic obstructive pulmonary disease, or COPD, is a serious lung disease that restricts your ability to breathe due to long-term irritation to the airways.
The patient with COPD has to work harder to breathe to get the air out. The air comes in fairly naturally, but they have to work to get the air out.
COPD is the third leading cause of death in the U.S., yet remains largely unknown.
Surveys have shown that people are not very knowledgeable about COPD. I think in the last 10 or 15 years, there's a growing population of people who understand that cigarettes can do this type of thing to their body.
But I started to notice a shortness of breath, I would say almost 10 years ago. But it's progressive. It made it harder for me to go upstairs or to do anything strenuous. I walk.
Trumpower signed up for Pulmonary Rehab at Dartmouth-Hitchcock, an 8-week combined exercise and education program for patients with chronic breathing problems.
When you can't breathe, it's scary. And when that happens, we tend to get anxious, and that can get you more short of breath. So we really talk about how to relax, feel like you're under control. And that's a big part of what pulmonary rehab is getting back control of your breathing and of your life.
No, the pulmonary rehab people adjust what you're doing to your own needs. They're very tuned into you.
After completing the program, Trumpower's goal was to climb the medieval stairways of Dubrovnik, a walled city in Croatia.
I used my portable oxygen for that and paced myself, but I walked the whole wall.
He told me that he wouldn't have been able to do that prior to our program. So either we gave him the courage to try it, or actually he was physically more fit, probably both.
Early diagnosis of COPD can help patients breathe better and live longer. Symptoms of COPD include constant coughing, or a smoker's cough, shortness of breath, feeling like you can't breathe, not being able to take a deep breath, and wheezing.
There's a simple test that can be done that can identify it fairly easily, and those are the standard breathing tests or pulmonary function tests.
Whether it's COPD, asthma, or lung disease, exercise has a distinctive role in the patient who breathes poorly.
There are studies that show that pulmonary rehab programs are as effective as some medications and also some surgeries that are done to help correct lung issues. So it's a pretty powerful tool.
Trumpower has dodged a few health bullets in recent years, but keeps going.
The second lung cancer in 2009 was actually a new lung cancer. It wasn't a reoccurrence of the first. So I don't play the lottery.
But he does continue with his exercise at home, still works in his flower garden, and these days you'll likely find Bernard behind the lens doing what he does best. As for the Alan Brout Orchid Project,
Alan keeps bringing orchids, so this might end up being a never-ending project.